Good day, ma'am. My name is Christopher Denaque, and today I'm going to have a return demonstration of the intramuscular injection. This is a part of parenteral administration. So first is we need to check the doctor's order. So checking the doctor's order, checking the chart of the patient is more reliable than the medication ticket. So we're going to check the doctor's order. Checking the doctor's order. Then the next is we need to check the medicine administration record, or the MAR. So check the label on the medication and carefully against the EMAR. So if you are using the EMAR, so this is to make sure that the correct medication is being prepared. So we need to ensure that the correctness of the medication. So we need to check the medication administration record, or the MAR. So we need to check. So we have here the ampule, so that we're going to use. So we need to follow the three checks for administrating medications. So we need to read the label of the medication. So first, when it is taken from the medication cart. Then next is before withdrawing the medication, and the third is after withdrawing. So we need to ensure that the medication is being withdrawn is also the packaging that has the same medication inside. It is much more efficient to recheck every time. So here is the ampule that we're going to use. So next, checking. So we have checked already the medication at the MAR, or the doctor's order of the physician. So next is we need to organize the equipment. So this is to promote time efficiency and eliminates delay to the procedure. So we need to prepare. So we have here the ampule, the syringe rather. So the sterile gauze pad, and the antiseptic. So we need to put it here where you're comfortable when preparing the medications. So next is perform hand hygiene and observe other appropriate infection prevention procedures. So this is to deter the spread of microorganisms. So I have here the antiseptic alcohol. So next is we need to prepare the medication ampule for the drug withdrawal. So flex the upper stem so that the medication that is stuck here will go down will go down below the stem. So next is use an ampule opener, or place a piece of sterile gauze, so here sterile gauze or alcohol wipe between your thumb and the ampule neck around the ampule. So and break off with bending it towards you to ensure that the ampule is broken away from you. So this is to the ampule glass is only breaking off away from yourself to prevent you from being injured or being pricked, or so that the discharges of the medication here will not go to you. So we've already broke the ampule. So by placing the antiseptic packet over the top of the ampule and breaking it from the top. So this is the rationale to break for any form of breakage. So we need to dispose this top of the ampule of the sharps container. So this is to avoid injury to others, or to be pricked by this one. So we need to discharge it. So Next is withdraws the medication. It places the ampule on a flat surface so that to secure that the ampule will not going to fall down to the ground. So next is we need to attach or remove the cups from the needle and insert the needles into the center of the ampule. So do not touch the rim of the ampule with the needle tip or the shaft. So this is aside from it will be contaminated in yourself. So you might also get pricked by the syringe or the ampule. So with a single dose of ampule, holds the ampule slightly on the side if necessary to obtain more than the ordered amount of medication. So so that it won't be difficult to withdraw the medication. Later, the nurse still needs to push the solution in the prescribed amount. So first we're going to get the syringe. So next is we need to dispose the filter needle by placing a sharps container. So this is to prevent a needle prick injury to the other. So we need to dispose the filter needle. Then next is giving an injection and replace the. So we need to replace the filter needle with a regular needle. So this is to tighten the cap and the hub of the needle and push solution into the needle to prescribe of the prescribed amount. So this is by tightening the hub, it secures the needle, and the needle will not be will spill in the medication inside. So we need to throw. So next is we need to need another the regular cup. So we're going to get the regular cup. So make sure that the cup is tight. So let us put it here. Then next is the intramuscular injection. So we need to check the MERs. This is to ensure the correctness of the medicine. So we need to check again for the medication. So we've already checked the medication last time. So it is the correct medication. Then next, we need to check the label of the medication carefully against the EMAR to make sure that the correct medication is being prepared. So checking it gives. So we need to check the medication every time. So this next, so we need to follow the 3 checks for administering the medication. So the first one is we need to read again the medication. So what is taken from the medication, when it's taken from the medication card, before withdrawing the medication and after withdrawing the medication. So the rationale of this is to ensure that the right medication to be withdrawn is also the packaging is the same medication inside. So it is much more efficient to look every time. So next is we need to organize the equipment. So this is to promote efficiency and to eliminate delay to the procedure. So we need to prepare again the medication that we are going to administer to the patient now. So we've already withdrawn the medication, so we need to prepare it now. So, next is we need to perform hand hygiene and observe other infection prevention procedures. So, this is to deter the spread of microorganisms. So, we need to perform hand hygiene again. So, we have here the antiseptic, alcohol. So, next is we need to prepare the medication from the ampule or vial for drug withdrawal. So, I've already done that. So, I've just prepared the medication. So, we need to provide client privacy. So, this is to eliminate the patient's anxiety and to give a patient privacy. So, and so that the patient can cooperate to the procedure effectively and efficiently. So, we can do that by closing the curtains and making sure that the windows are closed and the doors are closed. So, I can see that the doors are closed. So, now, next is we need to prepare the client. So, to secure the patient is ready for the procedure. So, preparing the client. So, ma'am, okay kasi yung position diya, ma'am. Okay, so we are going to, because the patient is a sitting position, so because we are going to administer the medication into her arm, particularly in her deltoid muscle. So, prior to performing the procedure, so introduce self and verify the client's identity using the agency protocol. So this is to verify that the administration of medicine is being rendered to the right patient. So, and this is also to establish rapport to the patient. So, good day, ma'am. My name is Christopher Denaque, and for today, ma'am, is pwede ko mag-ask sa inyo. And before ko mag-explain, no, is pwede ko mag-ask sa imong name. O sa imong birthday po. Okay. Patala ko sa imong Christmas. Okay, thank you. So, next is we need to assess the client in supine position, supine, lateral, prone, or sitting position. So, depending on the chosen site. So, if the target muscles is gluteus or gluteus medius here or ventrogluteal side, have the client in a supine position. So, we need to flex the knee. So, in lateral position. So, flex the upper leg and in the prone position. Toe in. So, and rationally, this is to have a proper access to the body site that is going to be used in the parenteral administration. So next is you need to explain the purpose of the medication and how it will go. It will help using the language that the patient can understand, because it is the right of the patient to know what is the medication that the patients will going to receive. So, good day, ma'am. Okay na ba sa'yo? Kasi yung gets na ay masabtan na istorya po, ma'am. Kakagets kay Tagalog po or Bisaya? Either. So, makagets kay Tagalog or Bisaya po. So, today, ma'am, is mag-administer ko sa imo ha o paracetamol. So, kani paracetamol po, ma'am, is for sa imong fever. So, kani siya, ma'am, ang side effects anemia po is kanang according sa ang side effects po niya, ma'am, is either magbaba yung mga fever, ma'am. So, magbaba dyan yung mga fever after administration sa administering ng nga tambal. So, kanina tambal is iturok na mo sa imuhang dali na part sa imuhang braso. So, after magturok, ma'am, if na side effects na nakibation, ma'am, na stomach pain or kanang mawalaan ka gana og kaon, then at the same time magbaba man yung fever ani, ma'am. So, i-inform lang ni ma'am if nakibation na yung mga bad na side effects. So, para ma-assist ka na mo dayon. So, i-inform ni mo dayon, ma'am. Okay ba tato, ma'am? Okay po. So, nasabtan ako ang iyon ko, ma'am. Okay, thank you. So next is we need to include the relevant information about the effects of the medication. So we've already said to the patient that the effects of the medication. So we need to select and locate and cleanse the site. So friction aids in cleaning the skin. A clean area is contaminated when soiled object is touched or rubbed over its surface. So we're going to use the alcohol and the cotton with alcohol. So If injections are frequent, alternate the sites. So avoid using the same site twice in a row. So this is to eliminate tissue damage to the patient. So, ma'am, kani siya na site, ma'am, is na injectan ba di siya that bago lang, ma'am? Okay, wala po. So, okay po, thank you po. So, sa pikas na po na injectan. Okay po, thank you. So, next is we need to locate the exact site for injection. So, this is the proper access. Is also one of the factor for an effective medication is to use the proper site of administering it. So, we need to locate the exact sites. Then next is we need to apply clean gloves. This is to protect for any form of discharge coming from the patients. We need to don gloves. Duty. So after applying gloves, so we need to clean the site with an antiseptic swab. So using a circular motion. So a clean area is contaminated when it's soiled and object is rubbed to its surface. So we need to clean. So, in cleaning, so transfer and hold the swab between the third and the fourth fingers of your non-dominant hand. So, this is the readiness of the needle withdrawal. So, the position of the swab in the client's skin is above the intended site. So, this is to have easy access to prevent the blood if there is will be punctured skin after injecting the medication. So, we're going to... So we need to prepare the syringe for injection. So we need to remove the needle over the discard without contaminating the needle. So pulling it straight up helps to prevent the needle prick and aids without contaminating the needle. So, if using a prefilled unit dose medication, take caution to avoid dripping medication on the needle prior to the injection. So, this does occur. Wipe the medication off the needle in the sterile gauze. So, we need to use a sterile gauze so that to eliminate contamination of the needle. So, make sure that there is no drips or drips on the needle of the medication. So next is we need to inject the medication using the Z-track technique. So uses the ulnar side of the non-dominant hand to pull the skin approximately 2.5 centimeters or 1 inch to the side. So other some circumstance such as for emaciated client or infant, the muscle may be pinched. So to establish the area that is going to be injected. So holding the syringe between your thumb and the forefinger as if holding a pen like this. So like this. Pierce the skin quickly and smoothly at a 90-degree angle. So you cannot reach the muscles if it's not 90 degrees angle. So we need to hold the barrel of the syringe steady with our non-dominant hand and aspirates by pulling the back of the plunger with your dominant hand. So, we need to aspirate it for 5 to 10 seconds. So, aspiration is an aid to verify if you have injected it into the vein because there might be blood in the tip of the needle. If the vein is hit, kindly discharge the syringe. So, we're going to administer the we need to administer the medication now. So, ma'am, mag-check ko ma'am hapon. So, we need to inject 90 degrees. Then, aspirate. then push. So there is no blood drawn. Then pull. Then okay, so if blood appears in the syringe, withdraw the needle, discharge the syringe, and prepare a new injection. So I've already administered the syringe and there is no blood being withdrawn after I aspirated the injection. The blood does not appear and so I injected the medication steadily and slowly, so approximately at 10 seconds per ml. So while holding the syringe and steady if using a ventrogluteal site or using when ventrogluteal site. So I administered it in the arms of the patient. So after the injection, wait 10 seconds of using if using the ventrogluteal site here. So the rationale is when doing a rapid injection may cause discomfort to the patient. So pain is minimized by inserting the needle without any hesitation. So next is withdraw the needle. So I've done withdrawing the needle. So withdrawing the needle smoothly is this at the same angle of insertion. So the pain is minimized by inserting the needle without hesitation. So next is apply with the side of the dry sponge. So or a cotton. So massaging can actually damage tissue. So be careful not to massage the site that being administered by the medication or the body site being used. So I put the dry cotton balls, so or sterile cotton balls in the body site being used. So it is not necessary to massage the area of the site of injection. So if bleeding occurs, so apply pressure with a dry sterile gauge until it stops. So the rationale is if you use gauge with alcohol, if the patient might get uncomfortable because of the pain, so because it stings. So alcohol can cause sting if there are wound or there are bleeding occurs. So next is we need to activates the needle for safety device or discards the unscapped needle and attach the syringe into the proper waste receptacle. So this is proper receptacles are used to eliminate others to be pricked by the needle syringe. So we are going to use it. We are going to discharge the syringe into the proper receptacles. So I've discharged already the syringe. So removes and discard gloves and performs hand hygiene again. So this by doing this is when it helps to deter the spread of microorganisms. So we need to do the aftercare as well. So we need to document after removing the gloves and performing hand hygiene again. So we need to document all relevant information. So the time of administration, the drug name, the dose, the route, and the client's reactions to the medication. So this is to secure the record and enhances for proper endorsement. So I've already recorded the patient's dose. So I've done the we just need to flip the medication record and record it on your for your endorsement purposes. So for your endorsement. So next is we need to assess the effectiveness of the medication at the time it's expected to act. So some may experience anaphylactic shock or may some severe side effects. So dahil na ta sa itong today ma'am, ato ang procedure. So if ever na kay bation ma'am, so ay sa kita sa proper ma'am ha, paiga ka ma'am. So dahil na ta sa itong procedure karon ma'am, so today is if ever na kay bation na ka ng lala sa imong kuan like kanang severe na imong stomach pain or kanang di na kaganahan magkaon is i-inform lang ang mga attending nurse or kanang ang on-duty na nurse, or if ever ako ang on-duty gyapon na nurse, inform na ko nimo para ma-assess ka na mo dito o matagaan ka na mo og pagtagad. So thank you ma'am sa imong cooperation karon. So have a great day of call for help if kanang nakibation. Okay po ba ma'am? Okay, thank you ma'am. Thank you po. Nako ma'am.